Hello everybody, this is Dr. Edward Kondrot, and I've been asked to do a short video on auricular ozone treatment. And what is auricular ozone treatment? Well, auricular means the ear, and this is administration of ozone through your ear. I've given previous YouTube videos on making ozonated eye drops, which I love. Also, a previous YouTube video on the use of rectal insufflation, which is administering ozone rectally. And now I'm going to be talking about auricular, administering ozone through your ear. So what's the big deal with ozone? Well, ozone is an important part of my medical practice. I feel it is very valuable for stimulating rejuvenation, stimulating healing, and reversing chronic eye disease. And of course, now with the concern of the COVID virus, many patients are embracing ozone therapy as a way to strengthen their immune system and potentially kill the virus. My good friend, Dr. Robert Rowan, gave an excellent interview on healthy vision. And if you'd like to listen to that interview, go to healthyvision.us. And I'd like to summarize some of the things that Dr. Rowan said about ozone, just so you know how important this treatment is. The most important factor in healing is oxygen. Oxygen is life, and without it we die. Ozone improves the body's oxygenation dramatically. It also increases 2,3-diphosphoglycerate, 2,3-DPG, in the red blood cells. And when this increases, it causes more oxygen to be released by the hemoglobin. So oxygen is good. Ozone also improves red blood cell flexibility. It allows these little red blood cells to go into tiny capillaries, which is essential, because if the red blood cells clot, they don't get into those tiny capillaries, you're not going to have oxygenation and circulation to your eye and your brain. And this is the cause of many strokes, when the blood coagulates and is blocked and doesn't go into those capillaries. Ozone also increases the arterial venous oxygen difference. So, when you take a deep breath, our arteries absorb the oxygen, and then it goes through our body, and the oxygen goes into our tissue, and then it goes into the venous system. So we measure the difference between oxygen in the arteries and the veins. The greater the difference, the more oxygen is utilized in the body. So ozone does improve the oxygen utilization. Ozone improves ATP production. I've been a big advocate of doing everything we can to improve ATP in your body. ATP is the gasoline of the cell. We need ATP for good cellular function. I like microcurrent because microcurrent stimulates ATP. There was a study done that showed that microcurrent improves ATP utilization production by 500%. Ozone also stimulates ATP. Ozone also increases key antioxidants. We know antioxidants are good, fighting infection, disease, strengthening our body. Ozone also modulates the immune system. It increases certain cytokinins that reduce inflammation and decreases certain cytokinins that increase inflammation. So a lot of times we have destruction in our body because of these inflammatory cytokinins that cause tissue damage. So ozone seems to balance this cytokine in our body and modulates the immune system. Ozone also reduces tumor necrosis factor alpha, TNF alpha. It thus reduces the lethal nature of certain insults such as stress and infection. So in other words, you have a greater chance of survival with undue stress and a major infection. So all these things sound pretty good, right? It also increases nitric oxide production. You've been hearing a lot of talk about nitric oxide on TV. In fact, every time I turn it on, there's a commercial for red beets, and red beets have been shown to increase the nitric oxide in the body. What does nitric oxide do? It improves circulation. and it also lowers blood pressure, gives you energy. So ozone does a lot of great things, and in addition, it's antiviral and antibacterial. So let's talk about the auricular ozone. So what you need for auricular ozone, you need a good stethoscope. It has to be a silicone stethoscope. It can't be one of those black plastic stethoscopes. And you need an ozone generator. So here I have my Stratus 03. I'm going to turn it on. There's my tank of oxygen. And you can see the valve is set on 1/4. The reason why we set it on 1/4, the rate of oxygen flow determines the ozone concentration. So the slower flow, the greater the ozone concentration. The faster the oxygen flow, the lower ozone concentration. So we want 1/4. That gives us about a 24 gamma. That's a concentration that we found to be effective for rectal insufflation and for auricular ozone. So I'm getting some ozone in my bag here. And I would start by maybe putting about 200 cc's. Some of the bags have a marker, which you can actually tell the volume of 200 cc's. But this big bag here probably has a total volume of maybe 1,000 cc's. So we're just going to put a little bit of ozone in here for this demonstration. So we're going to shut off the oxygen, turn off my generator. There's a little clamp here. Now, one thing that I discovered is when I bought my stethoscope, it's designed to be hooked up directly to the ozone generator and administered this way. You can do it that way, but I don't like that because there's a lot of ozone gas that's being emitted to the atmosphere, and ozone is toxic to your lungs. If you breathe a little bit, it's not going to cause a problem, but if you have a history of asthma or lung disease, you have to be careful. I have a history of asthma, so when I do this treatment, I'm going to make sure I have a well-ventilated room, put a fan, open up the windows. Now, I discovered a shortcut in your equipment that you get for rectal insufflation. This is the rectal catheter. What you can do is just cut off a small section, about 2 inches, which I did here, and then you can connect that to the end of your stethoscope. The other end can go directly into the bag. All right, so then I put the stethoscope into my ears. You may want to put a little bit of water. Some people, they get irritations in their ear. You do feel a little bit of warmth. I haven't had any problems, and I've been doing the auricular ozone just about every day now during the COVID virus. So I put the stethoscope in, open up the valve, and then I gradually squeeze the ozone, and you'll feel a little bit of warmth in your ear. And I do it slowly, maybe over 10-15 minutes. It's just a very, very effective treatment. And you can sit there, watch a movie, the news, relax as you're doing the ozone treatment. So this is a good treatment to use in conjunction with the rectal insufflation. If you have problems doing the rectal insufflation, then you just may want to do the auricular or do a combination. Remember, the more ozone you get into your body, the better. So more information, I do have a YouTube video on making ozonated eye drops, which I like for chronic inflammatory problems of the eye, dry eyes. I've also done a YouTube video on the rectal insufflation, and now the latest, auricular ozone. I'll have all of this information on my website, healingtheeye.com/ozone. So you'll go there, you can see the different links. If you do have any questions on the equipment, how to get started, go to healingtheeye.com. That's our website, all one word, healingtheeye.com. or give us a call at 800-430-9328, or shoot us an email at info@healingbi.com. So I'm going to thank you for watching this video, and this is Dr. Edward Kondrot wishing all of you good health and clear vision.